Hello, I'm Dr. Inman. This is a lecture on bladder infections in cats, kidney stones, bladder stones, urethral stones. In the feline, unfortunately, they are desert creatures. They're used to being nocturnal, and they're also used to drinking very little amounts of water. As a matter of fact, a cat living in the desert, which is what they're used for, and they've never really adapted otherwise, they'll get almost all their water from eating rodents, which is of course how they survive, and so they really don't drink a lot of water. And because of that, that urine basically in the kidney is basically designed just like a camel's kidney, so it reabsorbs water very, very effectively. It can concentrate urine up to almost a yellow syrup. However, if enough inorganic elements are in the actual diet, such as purina, cat chow, or what have you, essentially, that concentrated syrup or urine that gets very, very concentrated will actually precipitate the inorganic solutes in the urine, and it'll end up as crystals and stones and bladder stones, kidney stones, and also sludge in the bladder. You see that there can be stones here, there can be stones in the bladder, there can also be stones that will actually plug up the male cat's penis, which basically is a disaster. So they end up with a plugged tomcat. It has to be catheterized, and sometimes the surgery to open up that urethral area has to be done. I've done hundreds and hundreds of those surgeries before. Dietary regimens have actually limited and reduced the amount of inorganic solutes in the actual diet. However, animals or cats still have stones, they still have bladder problems, they still have urinary tract disease. I'd recommend that you look at feline lower urinary tract disease and feline urolithiasis syndrome miniature lectures that we've delivered up to this point. Our approach, of course, if you look at those, and also our approach at this, if they have stones, it can't, and also conditions if they're not plugged in a medical emergency, what we're doing with our technology is trying to dilute the urine. If the urine is diluted and it is in a normal concentration, for instance, with a specific gravity that's anywhere from 1015 up to 1025 or 1030 even, the stones will actually go back into solution, even an existing stone. Now, sometimes cats will have 10 or 15 bladder stones that are as big as a gumdrop, for instance, or as big as a jelly bean, and those are hard pressed to digest or to absolve. We may have to get rid of them. There's a lot of times that those particular stones are wrapped around colonies of bacteria, so they continually seed bacteria into the urinary tract, so the animal has a continual bladder infection secondarily to it. But a lot of these conditions are non-septic, in other words, they don't have antibacterials. What we have done in the past before we had laser is we would take and we'd use a somatovisceral approach as a means to try to optimize the blood supply to the kidney. 40% of the cardiac output goes normally through the kidney in the kitty cat. However, and I've done research in this regard, the cat that basically has a lot of elevated sympathetic tonus due to injury and vertebral subluxation complex in the spine will elevate the sympathetic tonus, decrease the parasympathetic tonus, and instead of 40% of the cardiac output going through the kidney, which is normal, only 20% does. So the cat is trying to do the same amount of metabolism and process the same amount of proteins and inorganics with only half as much blood. So that's going to give us very, very concentrated urine, and over a period of years it can give us stones, bladder stones, kidney stones, and also the sludge that is in the bladder, and also feline urolithiasis syndrome, which plugs up the tomcat. It'll also happen in the female cat. However, they're able to pass the stone, we don't have a medical emergency. Our approach then originally is to rebalance the autonomic nervous system and increase the blood supply through the kidney. Now, we can't get the cat to drink more water no matter what we try, so what we end up having to do is we end up having to optimize, which we should anyway, the blood supply through the kidney, and we do that through the somatovisceral therapy. In Module 4 of our courses, we show you how to do that. It's very easy, very quick to do, and it can give us a resultant response essentially within a few days. How do we determine whether or not the specific urinary tract is producing the right concentration of semi-dilute urine is through specific gravity, essentially. The specific gravity meters that we use in veterinary medicine are human ones. They're not designed to actually measure the area in the high range, essentially, of specific gravities that the cats have. We will very commonly tell or write down in our medical records that the specific gravity is 1050 plus, which means it's 1.050 or higher, because it's in that range and we really can't calculate where that is. The fact of the matter is that it is not accurate in that range, because they can have a specific gravity as high as 1.115, which is very, very, very high, and it looks like it's in that 1.050 range. But we can use that device, which is a human device, to evaluate whether the animal has adequate specific gravity, because it is accurate in the 1025 to 1035 area, which is where we want the urine specific gravity to be. And if it consistently is in the 1020 to 1040 area, essentially of specific gravity, it will dissolve these crystals, essentially regardless of what the animal is in fact eating. The other way that we can take care of this is that we will in fact utilize frequency-specific laser therapy, either this technique or another technique, as a means to optimize it. The frequency is 213. The frequency for the kidney is 43. The frequency for the bladder is 24. And the frequency for infection, which may or may not be present, is 784. Those four frequencies are delivered to the kitty cat over a period of about 180 seconds, twice a day, 3 days, once a day, 3 days, twice a week, 2 weeks. And then one of the things that we'll end up doing with that situation is to monitor the kitty cat as to infection, clinical experience essentially, or clinical conditions essentially, and also we'll want to monitor that cat's urinary specific gravity essentially. If it comes down into that normal range, then we know that we've won. We can also use a different tool where we can use a two-headed laser approach, where we'll laser with those same frequencies using a frequency a preset head essentially at the thoracic inlet, and this is done for 180 seconds also. The specific gravity in this particular situation is how we can monitor whether we're getting this problem taken care of or not. Our success rate is very, very high, essentially, in utilizing this approach, well over 90%, because the primary problem that the cat has this is not because the cat's unlucky. It's because the cat has acquired elevated sympathetic tonus, being on the planet and having injury that can in fact cause vertebral subluxation in the mid-thoracic area. This does not show up on x-ray. It will not show up on x-ray, and it's not diagnosable unless you use a tool like this, which will show that the cat's back is pretty quote-unquote hot, indicating vertebral subluxation complex. This has been a lecture on feline urolithiasis syndrome, feline lower urinary tract disease, also on feline bladder kidney stones, which will dissolve over a period of time using this therapy, and also the plug tomcat phenomenon in the kitty cat that we use the laser, and also feline somatovisceral therapy utilizing this technique to take care of the problem. If you have any questions, please go to the vomtech.com website, and remember that we have rather extensive amounts of information on somatovisceral therapy in the Module 2 and Module 4 of our actual course that we have for certification as that we see. And also we have extensive amounts of data in our course on frequency specific laser therapy. Thank you and have a great day.